So let's talk about 3 common conditions that you see every single day in your practice. And the reason I chose these 3 conditions to start you off with so you feel confident and comfortable referring to a chiropractor is because these are the most common or literature-based conditions that we treat that have been proven in the literature to be effective. And in fact, lower back pain is probably the #1 spinal complaint that you see in your practices. And it's at least probably the top 3 conditions that you treat. Now, the Journal of Spine actually says, hey, standard care along with chiropractic care can be really beneficial for the patient in improving pain scores and increasing function for the patient. Now, there's other conditions like headaches and neck pain we're all familiar with. We're behind computers now all day. We get the forward head posture. We get text neck. These are common conditions that are biomechanical problems that are addressed very well with chiropractic care. Now, when you make that referral to the doctor, what I'm going to suggest you do is monitor the patient. And the doctor of chiropractic should be doing the same thing. If the patient is gaining improvement within the first couple of weeks, then that's great. We continue care until we reach our stated goals. However, if the patient does not respond within the first 2 weeks, what we're going to do is we're going to alter our treatment protocol. There's something else going on. If after that 4th week we're still not making the improvement that we had wished for or that what we had anticipated, we're going to go ahead and refer the patient back to you for further investigation, further evaluation, and maybe some additional testing or referral. So these are common conditions that chiropractic can treat, and I think you'll have a lot of success with in working with your community chiropractor. Now, I don't want to bore you with all the information that's out there, all the literature-based information that is out there in regards to what chiropractic can do for your patients. But just to be aware that there's been some tremendous gains in chiropractic research over the past 10, 15, 20 years, and I'm really excited about that. Now, our next video, I'm really excited about this because our next video, we're gonna show you what happens during the physical adjustment, what physiological, neurological changes occur with that chiropractic adjustment. It's no longer, hey, he popped my back and I felt better, he cracked my neck. We want to actually make sure that you understand and feel confident when referring to the chiropractor, knowing what's happening in that patient's body. So look for that next video. And again, if you have any questions or comments, feel free to reach out to me at drkullmann.com, and you can email me or you can call me at my office and I'll get right back in touch with you. Once again, this is Dr. Jason Kullmann, Yours in Health. We look forward to talking with you soon. Okay, doctor, you're in your practice, the patient comes in, maybe they're not responding to your first line therapies, and the patient is getting a little frustrated, and they come up with a big question, doctor, what do you think about chiropractic? Can chiropractic help my condition? Do you know of a good chiropractor in my area that you can refer me to? Well, this can often be a tricky question for the primary treating physician because they just may not have enough experience with referring to a chiropractor or know of somebody in the area that they can trust. Hi, this is Dr. Jason Kullmann. I'm a practicing chiropractor right here in Oceanside, California, and I've been practicing for over 30 years. And these questions have prompted me to do a short video series to help educate the primary treating physician into chiropractic and what chiropractic does, what its limitations are. So I call it Chiropractic 101 for the family physician. Now, over the past 30 years, I've heard some interesting comments from patients, such as, my doctor doesn't like chiropractors. My doctor said, don't allow you to adjust my neck. So there's a lot of different, maybe miscommunication on what we're trying to accomplish with the patient. So hopefully over this series of videos, we'll give you some guides to help you refer confidently to the chiropractors in your area. So let's get started. So based on my experience, you as the primary treating physician, you're concerned about a few things. Is there enough research out there to show that the patient's condition can be helped with chiropractic? And then the other big question is the treatment going to be safe for the patient? So the risk-reward ratio is really imperative. Now, also what the primary treating physician wants to know is there a plan? We have to have, in third-party payer situations, we have to have a plan. There has to be a beginning, a middle, and an end to treatment care. And how are we going to document that functional improvement for the patient? So this is crucial, both for the chiropractor and the treating physician. After all, you are the primary treating physician. You're in charge of the case. We're just an adjunct to your practice. Now, will I receive updates on the patient's condition? Well, this is imperative. If the patient is not responding, then the patient has to be returned to the primary treating physician. So these are a few things that we're going to talk about as we go along in this video series, and I want you to be aware that we will do everything we can to help you and assist you, and I think I would like to get this communication going between the physicians and the chiropractors because we could really add a valuable service for the primary treating physician. So let's get started with a few common conditions that you may encounter in your office.